anatomy and physiology, we're going to be starting with the outer ear and working our way inside up through the central auditory nervous system all the way up to the cortex. So some of the objectives for this lecture, the first couple slides, there's some of them we're going to go into orientation and terminology, and then after that we're going to be going into the location of these auditory and vestibular structures so you guys can have a better idea of where they're located inside the head and inside the temporal bone. And then we're going to be going over, not in too much detail, but giving you more of a brief overview of the different portions of the ear. It's all based on the textbook you have. So some people are going to say there's 3 divisions of the ear, some's going to say there's 4, some says there's 5. It all depends. So really, as long as you guys know the different portions, so the outer ear, the middle ear, the inner ear, the auditory nerve, and then the central auditory nervous system. So as long as you guys know the main parts, I'm not really concerned that you guys know that there's 3 portions or 4 or 5. So we're going to be going over all of those, and then the major parts that are inside each of those divisions. Next, we're going to go over anatomy and physiology of the outer ear, and I want you guys to be able to name, if I put a picture on the exam of the pinna or a picture of the auditory canal, I want you guys to be able to name different structures. So more of a matching task or a fill in the blank. And then the purpose of these structures, focusing on the pinna, what does it do to the sound that's collected and channeled down into the ear canal? And then, in general, you guys should be able to describe, if I ask you like a short answer question, describe the propagation of sound through the outer ear. And this week, everything is going to be building on this. So we're going to start with the outer ear, discuss how sound propagates through it. Then we're going to move to the middle ear. Once we've finished the middle ear, I expect you guys to be able to describe sound propagation from the outer ear through the middle ear. And eventually, I want you guys to be able to describe it all the way up to the central auditory nervous system. So it's really important that you guys stay on top of the readings and studying because a lot of this information is going to be building on each other for the next couple weeks when we're discussing anatomy and physiology. Not to mention, you guys need to know the anatomy and physiology in order to be able to talk about disorders of the ear. So if you know the purpose of a structure, then you can say, okay, if something's wrong with this structure, this is how it's going to affect this person's hearing, or this is a type of hearing loss, and whether it's a slight hearing loss or a severe to profound, or if it's conductive versus sensory neural. So it's important that you guys know all these, the different structures and their purpose to discuss disorders as well. And we're going to be discussing mainly a lot of the disorders that are listed in the book, and then I have a couple extra ones. It's going to be more for the middle ear and the inner ear that I expand more on the disorders than focusing exactly what they have in the textbook. The ones that are listed are more basic, so we're going to go into more of the severe or more complex disorders as well. So starting with anatomy and physiology, first off, you need to know terminology. And the terminology that I'm really focused, that I really want you guys to know, are these 4 right here, the 4 in the center. The top and the bottom are pretty basic, and you've probably heard all of these terms before. So anterior towards the front, posterior towards the back, superior and inferior. And the reason why these are important is because we use these terms a lot when referring to the tympanic membrane. So you have the tympanic membrane, and essentially, and ENTs do this a lot, so you need to be able to read their reports. So you have the tympanic membrane. Maybe. Okay. Can't really see it as well, and I have a couple slides on, but it's divided into 4 quadrants. And each of those quadrants, so anterior towards the front, superior, anterior, inferior, and then you have posterior towards the back, and then superior and inferior. So top, bottom, front, back. So, and this is going to change depending on whether you're looking at a left ear or right ear. Because if you're looking at somebody's left ear, the one here is going to be towards the front. It's just going to switch. So you can't always say that one to the left is all the way And the way you're going to be able to tell is by looking at the conal light. So I'll show you that in the next couple slides. I have a bunch of pictures of normal looking tympanic membranes and then just some of the disorders that we'll be talking about in a little bit. So that's one of the reasons why knowing those four terminology is important, because sometimes ENTs will say there's a perforation of the tympanic membrane in this quadrant. You need to be able to know where that quadrant is, where it's located. It's going to affect their hearing. So planes of reference, this comes in more when we do imaging as well. We're really talking, a lot of the pictures that I have are more transverse, so just cutting you into horizontal slice top and bottom. So I have some pictures of the skull where the top's taken off as a transverse section, and that way you can look down from the top and see where the auditory and the vestibular structures are located. So if you think about the auditory system, so we know it's comprised of the auditory system, the vestibular system, so we have the cochlea, we have the semicircular canals. It's really situated right behind the eye, just a little bit lower. So it's easy to visualize the ear canal and the ear, because we can see the ear, the pinna on the external portion. So just think of a canal going straight in, and then we have the vestibular structures and the cochlea, the auditory structure. And then you can see you have the eustachian tube here going down to the back of the throat. So just think directly behind your eye. And obviously you have two ears, so you have two of these systems, left and right. This is another good view for you. So you can see the pinna. Portion on the outside that you guys can see, the external auditory canal. And it's important that you say external. So if you just say auditory canal, there's two different canals. There's the internal auditory canal, and then there's the external. So the the external portion is right here. The internal portion is over here, and the internal auditory canal is where the auditory nerve leaves the cochlea, travels through the internal auditory canal, and goes up to the brainstem. So that's why it's important that you differentiate in between the two, especially when talking about sound propagation. So you have the ear canal, the external, you have the tympanic membrane, you have the middle ear cavity or the middle ear space that's right here. Right here, this portion, this small black portion. And then you have the inner ear, which has a vestibular structure, so the semicircular canals here, and the cochlea. And this is a better in-depth, better picture for you guys, showing you all the different structures. So this would be something that would be good to know, so you guys can point out, okay, this is the pinna, this is the external auditory canal, tympanic membrane, the three bones. We have the semicircular canals here. And then we have the vestibular nerve fibers coming off the vestibular portion. We have the auditory nerve coming off of the cochlea. They merge together and go through the internal auditory canal. That's what that portion is right there. And then they travel up to the brainstem together.
So try to just use your fingers, like you were saying. So keep your arm and your wrist still, and then you just use your fingers to slowly insert it. Because that would be the entire length. That's enough distance for it to be inserted into the cochlea. You'll just need to get, yep, almost there, a little bit closer. And then I would start flattening your fingers out and just pushing. Yeah. A little bit harder than anticipated.
Yes. Am I in the right area?
You are. You're almost in. Yep. But now it's starting to bend a little bit.
Yeah.
So this isn't a pre-curved electrode array, so it would be easier in the real cochlea to just insert it and it would kind of curve around and hug the medulus.